Hello everybody, in this video we'll see the clinical diagnostic methods in endo. First we'll start with the pain in case of reversible pulpitis. In reversible pulpitis, there would be mild pain only for hot and cold food or sweet. It would not be referred, and there won't be any spontaneous pain, and it does not increase in night. Where in case of irreversible pulpitis, there will be severe pain for hot and cold food or sweet. Referred pain would be there, and also spontaneous pain would be reported by the patient, and also the intensity of pain will increase at night. Where in case of pulp necrosis, there would not be any pain, no referred pain, no spontaneous pain, and no increased pain at night. And on clinical examination for reversible pulpitis, it would be very less or small caries or minimal caries. In case of irreversible pulpitis, on clinical examination, we could see very small to big caries. And in case of pulpal necrosis, on clinical examination, we could see no caries or small caries or very big caries. Then on electric pulp test, in case of reversible pulpitis, the pain will be elicited by the patient at very less current, where in case of irreversible pulpitis, the pain will be more, the pain would be elicited only after exposure of more current, or rather higher intensity of current is required to elicit pain in case of irreversible pulpitis. And in case of pulpal necrosis, no pain would be present or experienced by the patient even after exposure of high intensity of current through an electric pulp tester. Now, the radiographic features of an irreversible pulpitis, there will be radiolucency in the enamel or enamel and dentin, but not involving the pulp. Where in case of irreversible pulpitis, the radiolucency will be present in enamel dentin, but involving the pulp. In case of pulp necrosis, no radiolucency or radiolucency involving enamel and dentin and pulp. Now, there is a classification for diseases of pulp. This classification is given in Grossman's 14th edition. Here, it is classified as inflammatory diseases of dental pulp, pulp degeneration, and pulp necrosis. Under inflammatory diseases of dental pulp, we have reversible pulpitis, which could be either acute reversible pulpitis or chronic reversible pulpitis. And under irreversible pulpitis, it could be either symptomatic irreversible pulpitis, which is previously known as acute irreversible pulpitis, or asymptomatic irreversible pulpitis, which was previously known as chronic irreversible pulpitis, and chronic hyperplastic pulpitis, which is also known as pulpal hyperplasia and internal resorption. Where in case of pulp degeneration, we have calcific degeneration or radiographic diagnosis can be made for the understanding of calcific degeneration and also fibrous degeneration. Under pulp necrosis, it could be pulp necrobiasis, where part of the pulp is necrotic and infected, the rest is irreversibly inflamed. Pulp necrosis with no signs of infection, and necrotic and infected pulp. Now, characteristic distinguishing features of pulpal diseases. This is again given in Grossman 14. You can just go through it. Thank you. And if there are any doubts, please leave it in the description. We'll take it from there.